if you were to have a UK dentist come in here now, what one piece of advice would you give him to help him, given your expertise and reference point in dentistry?
To help him?
To help him further his dentistry in the future.
Well, I think one of the assumptions a patient has when they come in is, the dentist is going to do whatever he's going to do. But oftentimes what happens is a patient ends up asking all the questions of the dental assistant or the front desk person. This is what I hear all the time. Mm. And so I think one of the pieces of advice I would give the dentist is, especially if you're going to talk about the change that you're trying to make in terms of materials and so on, is inform the patient. Have a little discourse with them about, hey, I'm going to do something a little different today, and here's why. I want the best for you. To show, in other words, don't come in and just be a technician, but be compassionate and caring about that patient's best outcomes. Because that's what they're concerned about. Oftentimes, we all like to talk about the fear of going to the dentist, and fear is also, dentists are actually motivated by fear. The fear of sensitivity of the patient, or the treatment won't turn out as best as possible. Just the stresses of doing it. So the only way you're going to break down fear in this environment is with confidence and with trust and knowing, that you're trying, the patient knows and you have faith in that you're trying to do the right thing and the best thing for that patient. I think they need to hear that more. And so I would encourage that. It's not about products. Again, it's always going to be about people. And I've learned the hard way that sometimes we need to be more transparent, about, we care. It's okay to be stoic, and boy, I just watched the Winston Churchill movie recently, and that was stoic. Yeah. But sometimes we just need to see the passion that you have, so that you're not seen, as G.B. Black said, as a mechanic or a technician. You're a doctor with compassion to take the best care for that patient. Now, and I'm not trying to generalize, I think a lot of dentists do care, but sometimes, in the high production day, and patients are moving and moving and moving, it's hard to sit and have that moment, but it's okay to touch a hand, and say, hey, I'm really glad you're here, I really care about, doing the right thing for you.